and in particular in the Eastern European section of Europe, there is an uncontrolled transmission of HIV. And we continue to argue with the governments of those countries which do very little in terms of putting people on treatment. That this is not only a crisis for the individual person that clearly suffers from a consequence of lack of political leadership in those countries, but equally well, the country is essentially building up a problem in terms of healthcare that will be much, much larger 5 or 10 years from now. So there's really an opportunity here to curtail and continuously epidemic spread of HIV, not only for the benefit of those with HIV, but also because early treatment will reduce TB transmission, and which is a major problem in the Eastern European region, in particular because much of the TB in that region are multi-drug resistant and therefore quite difficult to treat once it has developed. And we have a presentation this morning to exactly make that point, that people in Eastern Europe with TB, around 30 to 50% of them actually die as a consequence of the TB because the infection is so difficult to treat. So we really need to encourage those countries to continue to expand their treatment. But they need to not only do financial investment, but they also need to change their political will in order to really take this epidemic seriously.
Mike? Let me just add really quickly that several articles have already argued and demonstrated pretty effectively that it's either cost-effective or cost savings to do early treatment, and that's at 500, not to even take into consideration the more recent findings. And then the economists have weighed in Africa already that treatment increases productivity, increases GDP, and so this is kind of a no-brainer. It's just a question of the political will to make this investment instead of buying a submarine or whatever else. So I think that if you looked at a Journal of Health Affairs, I think it's about 2012, there's 3 articles by health economists with data showing what happens when you start people, and again, not as early as Jens has suggested, so things will get even better. Everything goes in the right direction. People work longer hours, and that's almost ignoring the transmission prevention benefits.
Sorry, go ahead.
Just on this issue, I think a lot of work actually has been done. We worked with UNAIDS, who took the lead on this, to develop a global investment case, basically looking at how many infections and how much mortality could be averted. And by 2030, if we really achieve the 90-90-90 by 2020, it would be something like 28 million infections could be averted, 21 million deaths could be averted. There is sort of a quite impressive return of investments per dollar investment, 1 to 5. So we have all the data. Maybe we need to use them more effectively and need to communicate them better.
Just for your information, Lancet HIV published a paper on Friday with actually real-world data as an economic analysis that we've done in British Columbia, showing that the strategy is cost-saving. Sorry.
Yeah, Julio, if I would say this, and this is sort of my last word on the especially in respect to Fred's question, I also think that we must look not only at that country level, but also at the individual level of the economic and social benefits for folks.